Hi everybody, it's Dr. Magnifico from jaundice.com. This is Nemo. He is only 4 years old. He is a cream colored kitty, but I don't know if you can notice kind of the bright yellow that he's got, kind of the thin part of the hair. And then his ears are bright yellow. His mouth is bright yellow. Look at those gums. Bright yellow, that is what we call icterus or jaundice. The other place to look is in the sclera, so the white of their eyes. And usually you'll see yellow there. Typically, we see this in liver disease in cats. There's a whole bunch of possible causes for icterus in cats. Typically, though, it's a liver something. The most common thing that I see with young cats is they have gotten stressed about something and they stop eating. They can actually stop eating for just a couple of hours and a couple of days, and they will get a disease called hepatic lipidosis. And that causes their liver to get really inflamed and really irritated, and then they stop processing the toxins normally and they will get this yellow color. The minute you start to see anorexia in a cat or yellow in a cat, you've got to see your vet. You were going to want to do blood work. We're typically going to want to do x-rays, and then you've got to get really aggressive. For me, if they can't afford an internal medicine consult or ultrasound guided biopsy of the liver, which typically is needed to get a diagnosis, then I start them on a steroid, and as an anti-inflammatory, I start them on an antibiotic, and we start force feeding. This guy has gotten so yellow that he is resisting force feeding, so we are putting a feeding tube in him today. He was part of a rescue. They came in to euthanize him because they did not have enough funds to do the ultrasound, the feeding tube, everything else that they needed. So he is sort of my Christmas present to the rescue and to the people who are helping him, who have really gone above and beyond. So I'm going to put a feeding tube in him, and we are going to force feed him through hopefully his hepatic lipidosis. Hopefully that's really the simplicity of his disease. And hopefully we will have a little Christmas miracle. So for those of you interested in helping out Nemo, you can call the clinic, or you can put a message on here, or you can private message us. I'm looking to help raise some funds for him because he's probably going to need a couple of weeks in the hospital being force fed. And not that that's expensive, but it is labor intense, so it is going to cost a couple $100. So I'm hoping that we can raise $400 to $600 to get this guy better. He's a very young, very happy, very wonderful kitty, and he definitely deserves a second chance. So if you've got a sick cat, especially if you've got a cat turning yellow, go find your vet, get really aggressive, put a feeding tube in. People are really reluctant to put feeding tubes in, and it really just costs cats their lives. It's not difficult to do. It's not expensive to do. Here, it's probably $200 to $300, and then start force feeding them. Keep them on their steroid, their antibiotic, and keep food available to them. At some point, they start eating again. But he, other than the yellow, looks really good, so we're going to give him another chance. If you're interested in learning more about him, you can find me here at Jaundice Vet, or you can always ask a pet-related question for free at poly.com. Happy holidays, everybody. Merry Christmas, and wish him luck. He definitely needs it. He's a wonderful boy. Take care. Bye.